Welcome to Derm-It Trotter, Don't Swear About Skincare, where host Dr. Shannon C. Trotter, a board-certified dermatologist, sits down with fellow dermatologists and skincare experts to separate fact from fiction and simplify skincare. Let's get started.
Welcome to the Derm-It Trotter, Don't Swear About Skincare podcast. On today's show, we have Dr. Varman here. She's a board-certified dermatologist and works in private practice at Shine Functional Dermatology in Northern California. Dr. Varman specializes in treating chronic skin conditions like psoriasis and eczema with a blend of conventional and functional medicine practices. She also has a passion for photoimmunology, or basically, how does light and the immune system sort of intertwine and affect each other, which we're going to talk more about today. And she's also the owner of Shine Nutraceuticals as well. Welcome to the podcast, Dr. Varman.
Thank you so much for having me.
So, Dr. Varman, I know, or Katie, if you don't mind if I call you here on the podcast today, as colleagues, I think in dermatology, we sort of get blamed for making the sun sort of this evil entity. So my hope was to have you come on today, talk more about, the benefits, that there are benefits of sun exposure. As dermatologists, that we're not, completely against that in the sun, and kind of, how you explain that to a patient, or how you want to walk us through that a little bit. So we have a better understanding of our relationship, with the sun, and that it doesn't have to be one that's full of animosity and hatred.
Mm-hmm. Exactly. And I think, coming out of dermatology residency, all of our training is geared towards sun protection because we know that there's a lot of damaging effects that the sun has on the skin, whether you're just talking about sunspots and freckling or things like skin cancer. We know that there's a very direct relationship between too much sun exposure and skin damage and cancer. But what we don't talk about so much in residency and training and everything are the benefits of sunlight. And that's something that I developed a passion for just kind of very organically throughout, my first 5 years or so in practice, is really learning that there are benefits to sunlight exposure, and then how do we, as dermatologists, kind of bridge that gap for people so we can really educate about how to get enough sunlight exposure to get reap all the benefits for your body as a whole, but then also be mindful of not overdo it and put yourself at unnecessary risk of skin cancer and photoaging and all of those things also. And so what I've really been working on is how do we navigate that space, and how do you educate people so that they can get the sunshine, which isn't, it's not baby oil and burning and all of this. It's a moderate amount, but how do you get that so that you can reap the benefits, and then support your body using things like diet, nutrition, and sometimes nutraceutical to tolerate light well enough and not put yourself at unnecessary risk. And so that's what I love talking about. And I think today we'll talk a lot about the benefits, just to set that stage.
Yeah, and I like how you talk about, the sun doesn't have to be, our enemy, if you will. And I think that's something important for dermatologists to really think twice about, because I think it is a little taboo in our own specialty. And sometimes we do get on our high horse a little bit about sun protection, obviously, going after someone's risk of skin cancer and trying to really make them diligent about protection. But why don't you touch a bit on, just I think the health benefits for sun, and talking about that, kind of how that plays a role, maybe whether it's with the immune system or maybe benefits for the heart, as well, things like that.
Yes, and in dermatology, I focus a lot on the benefits of sunlight when it comes to autoimmune and inflammatory conditions, right? Because we know we use UVB therapy, phototherapy in dermatology to treat inflammatory conditions like psoriasis and eczema. So there's certainly benefits when it comes to those types of skin conditions, but it does expand much more broadly. So to kind of touch on the main topics, so like you said, cardiovascular disease. There is no paucity of literature when it comes to benefits for cardiovascular disease. Dr. Richard Weller out of the UK, way back, like in early, as like 2010 or so, in this time period, he was already talking a lot about the benefits of sunlight when it comes to cardiovascular disease, and he presented a TED talk with this beautiful chart of like the UK, and you can see this very clear risk gradient when it comes to UV exposure and cardiovascular disease. And what he talks a lot about is people attribute it to vitamin D deficiency. Everything vitamin D, vitamin D, vitamin D. Oh yeah, sun is important because of the vitamin D, but it turns out that sunlight has many more effects on the human body than just vitamin D. And so he really outlines the benefit for cardiovascular disease really nicely, and there's tons of literature to support that as well. And independent of vitamin D, what sun does is it releases stores of nitric oxide from the skin, and then you get this beautiful vasodilation, you get like reduced platelet aggregation, and all of these downstream effects from sunlight on the skin that are both dependent and independent of vitamin D, which really pretty dramatically decreases cardiovascular risk. Cardiovascular is its own, topic, but definitely sun exposure is very important. And then there's other inflammatory and autoimmune conditions. So outside of the skin, we see that same latitude relationship, right? Where if you live at the northern latitudes, you're at a much higher risk of developing autoimmune conditions like multiple sclerosis, type 1 diabetes, even an inflammatory bowel disease than if you live at the lower latitudes. And again, it was always vitamin D, vitamin D, vitamin D, but we've had huge studies with tens of thousands of patients, that have been published independently in like the last 5-10 years that really don't show a huge benefit from vitamin D supplementation. And so there's this kind of like disconnect. It's like, well, all of these diseases are associated with deficiency in vitamin D. And yet when we supplement, we're not seeing a reduction in all-cause mortality. We're not seeing a reduction in cardiovascular disease to the degree that we should. So what is it? And it's like, well, it's obvious, right? There's benefits to sunlight that extend beyond vitamin D. So sunlight, autoimmune and inflammatory, mood benefit, there's microbiome benefits, which I'd love to talk more about too, both in the gut and on the skin. And so there almost isn't a part of human physiology that isn't touched by sunlight exposure. It's really not just the skin.
Well, let's dive into that microbiome. We've talked about this before on the podcast. We tell our patients and talk about, hey, there's lots of bacteria, viruses, fungi, yeast, living on the skin, microorganisms too, as we all know, kind of hanging out in the gut and really determine our immune health. What does light exposure or sunlight do for our microbiome?
Microbiome is definitely one of my most favorite topics, but from a skin perspective, what we know a lot from UVB studies, but also just in general with sunlight and mouse models and everything, is that when you shine ultraviolet light on the skin, it changes the flora of the skin, because we all have bacteria. Most people are familiar with the microbiome of the gut, but we all have a microbiome on our skin as well. And like you said, that microbiome is responsible for the immune system in the skin. It plays it like a marionette, right? And it's also responsible for the integrity of the skin, so the strength of the skin in conditions like eczema. We all know that staph bacteria and eczema go hand in hand, where it's actually degrading, the barrier function of the skin. And so the composition of the microbiome on the skin makes a very big difference in overall skin health. And what UV light does is it decreases levels of Staph aureus, right? The Staph aureus is the dangerous, not necessarily dangerous, it's normal flora, but it can become problematic on the skin when it's overgrown, and strep bacteria as well. It also decreases types of yeast on the skin, something called pittosporum, which can cause problems for certain people when it overgrows. And then it also increases beneficial bacteria. So there's a type of bacteria called Staph epidermidis, which actually has benefits on the skin. And there's animal models that show that it reduces the risk of skin cancer after UV exposure when you have a good amount of Staph epidermidis, and it increases what are called antimicrobial peptides, which give you good defense against other bacteria. So on the skin, we really have some pretty robust evidence that the microbiome can be balanced by UV. But at the same time, it's a balance, right? If you overdo UV, it's a Goldilocks phenomenon. You're creating inflammation and you're creating problems. But the same thing, if you underdo it, you can allow overgrowth of some of these pathogenic, kind of more obnoxious organisms. So on the skin, there's that nice sweet spot. But then what we also know is in the gut, and a lot of people don't realize that sunlight on your skin influences your whole body, and the gut microbiome actually is influenced as well. It increases the diversity of the gut microbiome, which we know is associated with better health, and that is independent of vitamin D. So again, vitamin D is very important, but it's not the whole picture. And what's fun is in mice, you can actually knock out vitamin D. And so you can prove these things, right? You know for a fact that it's not the vitamin D because you like knock out the receptors in these mice and they still have the benefit and the diversity. So, so from a microbiome perspective, sunlight absolutely can help balance it when you have the appropriate amounts.
Nate, you're probably going to blow a lot of people away with what you just said, because I think vitamin D has been a hang up for a lot of us, even from dermatology to oncology. I mean, looking at those levels, really stressing the value and importance, which, it definitely is there. But like you said, it's not the whole story or the whole picture. So I think getting people to understand that and appreciate that, very important, what you highlighted. And then also, I think minds might be blown by the mere fact you said you can get ultraviolet light to maybe help prevent skin cancer. I think people in their minds are like, wow. I mean, you said that along with everything else, but I really want to focus on that just as a point, because I think that would be shocking to a lot of people out there, and even our dermatologist colleagues that listen, to really understand that value or role, because we kind of, the pendulum swung kind of far the other direction of like, gosh, almost live like a hermit, stay out of the sun,
Vampire.
and I think,
Yeah.
the focus though, or I would say kind of what I hear you saying, and I think emphasizing this, like so many things in life, and I'm a big proponent of this, it's just simply, moderation and balance. It's amazing how balance comes back into our lives in so many forms. And I think it's just interesting the way you present this and the information that, sunlight, ultraviolet light, is in the same way that we should think about it, which makes sense. I mean, we're all here on this planet, for a reason. We have the sun to do so many great things, but like anything else, too much of a great thing may be bad, too little is too bad. And again, it's like you said, that sweet spot right in the middle. So I really think that's a great take-home message that you're kind of highlighting there for our listeners as well. So how do you talk about sort of like some of the other, are there other comments on the mechanisms, like how it helps like with the immune system and its activity? Just touching on ultraviolet light, is it something that can suppress the immune system too, or you mentioned it for inflammatory disease, or it might be helpful if somebody has eczema or psoriasis, just kind of that increased tolerance that, is kind of a concept people talk about. What are your thoughts on those types of things?
Yes, and that was really what kind of brought me to learn a lot more in this kind of area of photoimmunology, how the immune system influences how sunlight influences the immune system. And the whole idea of tolerance is essential to everything. And so what's a really, really, really important point to make, and something that unless you really think about it, it doesn't it's not entirely obvious, but when you are exposed to, say, a grass or a dander or something, a potential allergen, when you do not have a reaction to that dust, it's not the absence of a reaction that's going on in your body. It is a very active phenomenon that's happening where your body is seeing that allergen and it's communicating and talking and it's deciding, I'm not going to react, because you've developed tolerance to it. So the absence of a reaction is actually a very, very active phenomenon. Your body is making a decision with absolutely everything it is coming into contact with. And it's that balance, right? It's the balance of reactivity or tolerance. And that is such an important point to make when it comes to things like eczema, because when you're looking at eczema, they're tipped towards reactivity, right? Like everything in an eczema is, and specifically atopic dermatitis picture, where there's all sort developing IgE, very typical allergic reactions to to airborne allergens, and you're getting asthma and food allergies, and it's just this very reactive picture. And what the whole goal is to help that person create tolerance to their own bodies, because we know there are autoantigens in eczema as well, where the body is developing antibodies against your own body at that point. And so we want to help the body create tolerance to their own body, but then also to the entire world around them. And when your body is inflamed and primed, we know that you're at much, much, much higher likelihood of developing even more allergies over time. And so that's why when you have to be very careful what you put on eczema skin, because if you're putting soy and wheat and food products and all these kind of things on eczema skin, you're much more likely to develop a new allergy or fragrance or whatever. So this idea of tolerance is really, really critical. And there are ways that we can skew whether you develop tolerance or whether you develop allergy. And one of the biggest things, two of the biggest things, sunshine and the microbiome in the gut. And we'll talk a little bit more about sunshine because that's what we're talking about today, and that's my fun, but my favorite thing. But in the gut, we know that the microbiome is largely responsible for whether those little T cells, so those immune cells that are floating around, whether they go down the pathway of being reactive or whether they go down the pathway of being tolerant and not reacting against dust standards and all those things. And the gut microbiome plays a role because all those little bacteria are sitting in there. And the good guys, when you feed them fibers and polyphenols and all the lovely stuff, they essentially excrete all these things that tell your T cells to become regulatory cells, become tolerant of the world and the environment and the stuff that you see in your gut. Versus without those, we call them short chain fatty acids and other byproducts, you become more reactive. And so the gut microbiome plays a very, very big role, which is why Western diet and everything like that is so problematic. But the other half of it is the sun exposure. And sorry, that's a long-winded answer to get there, but sunlight, and it was mind-blowing to me when I first learned about it, specifically UV light creates tolerance both in the skin and internally at the level of like the spleen, the lymph node, the bone marrow. And stop me if I'm rambling, but there's studies that go back to like the early 90s and 80s where this Dr. Kripke and her team, they were the ones that first really identified the immunosuppressive effects of sunlight, specifically in the skin. So if you blast a little mouse, with radiation, with UV radiation, they'll get skin cancers, they'll get tumors. But those little tumors are actually very antigenic, meaning your immune system can see them really, really easily. So if you put that little tumor on another mouse, it gets rid of it, no problem, it just clears it. And so she's like, okay, well, maybe there's something immunosuppressive about, this light. And so then they did studies where they put strong sensitizers, so things that should cause an allergy onto the ears of these little mice. And if you put an allergen at the same time as UV exposure, especially UVB, the mouse will actually develop a tolerance to that allergen or less of a reaction. And so they identified that UV causes immunosuppression enough that you develop tolerance, but it's not just that you're blocking a reaction, you're creating regulatory T cells. And so that tolerance is sustainable, meaning next time if you expose to the allergen, even without the light, they won't react because you have those T cells, and it's transferable. So you can take that and shove it into another mouse, and then they also won't react to that allergen. And that's kind of how we found that sunlight makes regulatory T cells. And then we found later that it also makes regulatory B cells deeper in the body. And so it is immunosuppressive in ways which can create skin cancer, not so great, but it's also immunosuppressive in a much more delicate way where it calms down what might be an otherwise overreactive immune system.
Very cool. And I think that's where people may have heard the connection, like, how in the world as a dermatologist could you recommend light therapy or phototherapy for my eczema or psoriasis when, you're always telling me to protect my skin because you don't want me to get skin cancer. And I think that was a great summary to help, patients understand this is the why, this is where there's potentially a role and where it can really affect the immune system and those skin conditions where the immune system's a little too active and again, out of balance. And we're trying to bring that balance back to the skin with light therapy or phototherapy. So in our last few minutes, what type of personal recommendations do you have for, just the kind of sun exposure that you think is appropriate based on risk factors, benefits, but at the same time, minimizing risk for patients? Because I think that's the thing. Again, people are trying to find that balance with the sun.
Correct. And it really isn't a ton. Like I said before, it's not baking in the sun. So in general, there's a Dr. Webb who's done amazing work kind of figuring out exactly what this question is. And in general, 5 to 30 minutes, so we're not talking a long time, 5 to 30 minutes of midday sun. And again, this goes against the Academy's recommendation to stay out of midday sun, but midday sun is when you get your biggest bang for your buck with UVB we don't need all this extra UVA. The UVB is what is really working on the immune system. And so midday, 5 to 30 minutes, 3 days a week to about 25% of your body, your skin surface area. So arms and legs, or face, lower arms, lower legs, although I like to cover the face in general, but it doesn't take much skin exposure to get that 25%. That's going to keep you out of the deficiency range for vitamin D. And we use vitamin D levels as a surrogate, as a marker for adequate sun exposure, because we don't really have better markers, but we know a lot about disease related to different levels of vitamin D. So using vitamin D as a marker of adequate sun exposure, 5 to 30 minutes, depending on your skin type, where you are, makes all of the difference. 3 times a week, midday, is enough to keep you in that adequate range. It really doesn't take a lot. And there are very, very cool tools available online where you can actually get exact times based on where you are, what skin type you have, how much skin is exposed, and how much sunlight it gets during that season, to get 1,000 IUs of vitamin D, and how long it would take to burn. And I can share those resources, but they're fun tools. But if you stay in that 5 to 30 minutes and use your judgment with understanding of what your skin type is and risk factors, usually that's a good range to get adequate sunlight. And I think we're going to talk a little bit more later about the different oral dietary things you can do, lifestyle things that you can do, and potential supplements that you can do if you fall into a higher risk category, and how you can support your skin in ways that go beyond just sunscreen use.
That's a great tease for our next podcast we're going to do together. Because for listeners out there, I'm sure a lot of you are maybe surprised that, for a dermatology podcast, that we're talking about the benefits of sun, but we're all about presenting, the pluses and minuses of everything that we all do. And I think too, sometimes we focus on, the negative aspects of sun exposure. So hopefully you've been enlightened today about the benefits of sun. And stay tuned for another podcast that I'm going to do with Katie to talk more about, as she mentioned, sort of diet and nutraceuticals as well for sun protection. But before we kind of sign off for today, do you mind sharing with our listeners, Katie, where they can find you online?
Absolutely. So I'm not terribly active on social media. We do have an Instagram. It's shine_dermatology. And we are pretty active on our website in general, which is shinefunctionalmed.com. So right now there's not a whole lot of other places online where we're at, but you can follow along and we'll keep those areas updated.
Great. Thank you so much. This is a fascinating topic. So I'm so excited to have you on for a few additional podcasts. So be on the lookout for those, and stay tuned for the next episode of Derm-It Trotter. Don't swear about skincare.
Thanks for listening to Derm-It Trotter. For more about skincare, visit dermittrotter.com. Don't forget to subscribe, leave a review, and share this podcast with anyone who needs a little skincare sanity. Until next time, stay skin smart.